In a physiologically normal joint, the disc is positioned between the mandibular condyle and the posterior slope of the articular eminence when the jaw is closed. So this is the normal physiologic condition. This is the closed mouth position, that is when the jaw is closed, and this diagram shows when the jaw is opened. So this is the articular eminence. This is the articular disc and this is the condyle. So what happens in case of normal physiologic position? The disc is positioned between the mandibular condyle and the posterior slope of the articular eminence when the mouth is closed. And when the mouth is opened, the disc slides into a position between the condyle and the top of the eminence. The attachments of the disc prevent its displacement during opening. The internal derangement of TMJ can be divided into two subgroups, that is basically internal derangement with disc displacement with reduction and disc displacement without reduction. In the disc displacement with reduction case, the disc has slight deformation and forward displacement when the jaw is closed. So here we can see the disc is displaced a bit forward when the jaw is closed. The displaced disc reduces to normal position at maximal mouth opening. So this is the maximal mouth opening. The disc is positioned. The disc goes to its normal position at maximal mouth opening, and we hear the first clicking noise. When the jaw is intended to close, the disc displacement displaces forward again. That is, the second click noise is heard, which is known as the reciprocal click. The patient with disc displacement with reduction has symptoms of TMJ pain with clicking, intermittent locking of the joint, orofacial pain without limitation on mouth opening. Disc displacement and reduction can be observed in open and closed mouth MRI examination. Now, in case of disc displacement without reduction, the disc has moderate to severe deformation. This disc has moderate to severe deformation and forward displacement when the jaw is closed. So we can see it is forwardly displaced when the mouth is closed. During mouth opening, the disc cannot return to its normal position and the disc is compressed between the condyle and the articular eminence, so as the disorder progresses. The patient with disc displacement without reduction has symptoms of increased TMJ pain and orofacial pain along with restricted mandibular motion. The click noise disappears. However, in advanced cases, crepitation noise appears as a result of the degenerative changes. In unilateral disc displacement cases, the patient shows restricted contralateral jaw movement, while in ipsilateral movement is normal. In advanced stages of disc displacement without reduction, increased degenerative changes including disc perforation and abrasion of the underlying bone can also occur.